It's 11 a.m. here in Seoul. I'm Woo Soo-young at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus outbreak here in the country. In just a few moments, we're going to cut into the briefing at the Sejong Government Complex with simultaneous interpretation available in English. We're going to go into the briefing room now, where Yoon Tae-ho, Director General of Public Health Policy, will be sharing the latest figures and updates on the COVID-19 situation in the country. So we're just about to do that now, and the Director General of Health Policy will be telling us the latest number of infection cases, how many there have been overnight, and the latest death toll as well. So you see him over there at the podium, and it looks like the briefing's just about to start.
Let us now begin our regular briefing for April 28th, Tuesday. As of today midnight, we have 14 new cases, and a total of 8,854 have been discharged. And currently we have a total of 1,654 people in quarantine, and the death toll stands at 244, up 1 from the day before. I extend my deepest condolences to the deceased and the members of the bereaved family. And out of the 14 new cases, 2 have been reported through community infection, and we had a total of 12 imported cases. And of them, 3 have been reported at the airport quarantine, while the rest of the 9 have been reported at the community level. At today's KCDC meeting this morning, we discussed with related ministries on diverse issues, and we touched upon issues of our support for small businesses and self-employed, as well as other supports going on. And for the details, please refer to your press kit. And today marks the 100th day since the first COVID-19 patient has been reported here in the country. And we had small and big crises, but we were able to overcome this difficult situation thanks to the participation of the public, medical staff, and the government officials. And we also vowed to exert our deepest efforts going forward during the so-called Golden Holiday Week. And today marks the 100th day since we had the first ever COVID-19 patient. And we have been managing the crisis very well for about 1 month since then. And after the first outbreak in Daegu, and with the cluster infection at Shincheonji, we saw an exponential increase of the number of newly confirmed cases. The number of daily confirmed cases topped over 800 a day, and the number of people under treatment also exceeded 7,000. However, we have overcome this crisis, and we are seeing a decrease of the number of on-day increase of the confirmed patients, and we have 1,654 people in quarantine thanks to the efforts put forth by the medical staff and a lot of other people. And the government also expanded our testing capability, and we expanded the number of the screening centers, and we had 693 screening centers nationwide, and we also extended our scope of testing. And the testing analysis sites also have been carried out at multiple other institutions, and this has been praised as the most proactive diagnostic policy in the global society. And we were able to identify the patients at an early stage and to progress going forward. And we also had innovative ideas, including the drive-through screening centers as well as walk-through screening centers, and to enable accurate and swift testings. Moreover, as we had a surge in the number of patients, as we saw a shortage of medical staff at Daegu and the Gyeongbuk region, we had about 400 medical staff who were dispatched to the site very swiftly. And we would like to thank all of the medical staff members who have been taking part in the process of treatment and screening centers despite all the difficulties. Meanwhile, we are seeing a concentrated treatment of the COVID-19 patients, and we have designated 69 designated hospitals with 7,500 hospital beds, and we also have nationwide live treatment centers with more than 30,000 hospital beds. And this was very different from our response against other infectious diseases because we had the majority of the patients who had mild symptoms. And also, this was our initial response to the fast infection rate of the COVID-19. And we were able to effectively manage our resources that were available at our hands. Despite the global pandemic, we are seeing a stabilizing in the situation, and this was all possible thanks to the dedication and efforts put forth by our medical staff members. And based on solidarity of the community, our public also showed high level of civil awareness and showed great active cooperation in our measures as well. Aside from the medical workers, there are many people who are fighting on the front lines of the COVID-19. And we extend our deepest condolences, deepest gratitude to all of them as well. There are the janitors who are cleaning up the medical hospitals, and the people who are working with the wastes of from the medical hospitals. And there are also many people who are volunteering to help out the vulnerable class. And there are also government officials in the local communities who are spending sleepless nights to fight over the COVID-19. And thanks to all of their efforts and dedication, we were able to overcome the outbreak to a certain extent. The list goes on, and I cannot list every one of them. However, we have a lot of hidden heroes in our society, and I ask the public to send our gratitude to these hidden heroes. Despite our ongoing efforts, we are seeing a prolonged outbreak here in the country, and until we have a development of the vaccines and therapeutics, we can never put our guards down. Many people are showing great responsibility. However, we are seeing increase in the number of gatherings and outings, and if people have closer physical contact, the risks of infection also increases. And the warm weather, as well as the upcoming golden holiday, I understand that against such background, you are planning to have more outings and more travels. However, please refrain from large gatherings. And we also refrain from dining before or after using outdoor sports facilities with a large group of people. And just as you did, please keep your personal hygiene measures going forward, including washing of your hands and keeping of coughing etiquettes. We have been praised globally as a model example for quarantine, and thanks to all of your efforts. And looking back on the past 100 days, we had many obstacles. However, we certainly cannot be sure when the outbreak will end. Despite all of these difficulties, we are making a new chapter in our history, thanks to our capability to identify and diagnose the patients at an early stage, as well as establishing our more tightened screening measures on our quarantine for the borders. And these are some of the new chapters in history that we are continuing to write. And we believe that being complacency would lead to a large cluster infections, which will put all of our efforts in vain. So we ask the public to continue to participate in our efforts going forward. Thank you very much.
Well, that was a live briefing from the South Korean health authorities. You just heard that. We've just been told that there were 14 additional infection cases, bringing the total number of COVID-19 cases here in the country to 10,752. There have been, unfortunately, one more death, and that brings the total death toll to 244. That concludes our coverage of this morning's briefing. We'll be back in just a short while at 12 p.m. Korea time with our regular midday news. Bye for now.